Have you ever experienced a persistent ache in your bones, perhaps wondering what might be causing it? It is completely natural to feel concerned when our bodies send us signals like this, and thankfully, medical science has advanced greatly in understanding these messages. Distinguishing between a harmless bone growth and something more serious is a crucial step toward peace of mind and appropriate care. Doctors distinguish bone cancer from benign, or non-cancerous, tumors through a careful and systematic process that primarily involves advanced imaging studies and a tissue biopsy. This comprehensive approach allows medical professionals to examine the characteristics of the growth at both a macroscopic, or visible, level and a microscopic cellular level. The core mechanism behind this distinction lies in identifying specific patterns of growth and cellular behavior. When reviewing imaging like X-rays, MRI scans, or CT scans, doctors look for key features. Benign tumors often show well-defined, smooth borders indicating slow and contained growth. They might have a sclerotic rim, meaning a dense, hardened edge, and typically do not invade surrounding soft tissues. Conversely, cancerous tumors often display aggressive characteristics such as irregular, poorly defined margins, evidence of bone destruction, and sometimes a soft tissue mass extending beyond the bone. Features like a periosteal reaction, which is new bone formation on the surface of the existing bone, can be either benign or malignant, but certain patterns, like a sunburst or Codman's triangle, strongly suggest malignancy. Following imaging, a biopsy is often the definitive step. During a biopsy, a small sample of the bone growth is removed and sent to a pathologist. Under the microscope, the pathologist can analyze the cells for signs of malignancy. Cancerous cells typically show abnormal features such as rapid division, irregular shapes, and large, atypical nuclei. They may also exhibit an invasive growth pattern, meaning they are spreading into surrounding healthy tissue. Benign tumor cells, however, generally appear more organized and closely resemble normal bone cells. For the patient, this diagnostic journey typically begins with a visit to their doctor, especially if they are experiencing unexplained bone pain, swelling, or a palpable lump. The doctor will likely start with a physical examination and initial X-rays. If these images raise any concerns, further specialized imaging will be ordered. It is important for you to openly communicate all your symptoms and medical history with your healthcare team. If a biopsy is recommended, understanding this procedure and asking questions can help alleviate any anxiety you may have. One fascinating detail in diagnosis involves the use of immunohistochemistry in biopsy analysis. This technique uses antibodies to identify specific proteins on or within cells, which can help classify the exact type of tumor, whether benign or malignant, and guide treatment decisions. For instance, an osteoid osteoma, a common benign bone tumor, often shows a characteristic nidus, or core of new bone, surrounded by dense bone on imaging. In contrast, an osteosarcoma, a common malignant bone cancer, will show highly abnormal cells producing immature bone matrix, confirming its cancerous nature. These precise cellular and architectural insights are invaluable. Ultimately, the goal of this meticulous diagnostic process is to provide a clear and accurate understanding of any bone abnormality. By combining detailed imaging analysis with the microscopic precision of a biopsy, doctors ensure that each patient receives a precise diagnosis. This careful, multidisciplinary approach, involving radiologists, orthopedic oncologists, and pathologists, forms the bedrock of effective treatment planning, leading to the best possible outcomes for your health and well-being.